Have you ever wondered why a doctor strokes the bottom of a patient's foot with a blunt object during a neurological examination? What could this peculiar test possibly reveal about a person's nervous system? This, dear listeners, is the intriguing world of the Babinski sign. The Babinski sign, named after the French neurologist Joseph Babinski, is a telltale movement of the toes in response to stimulation. When the lateral part of the sole is stroked, a normal response in adults is the curling down of all toes, known technically as plantar flexion. However, in some cases, the big toe extends upward while the other toes fan out. This unusual reaction is the Babinski sign. So, what causes the Babinski sign? It's all about the pathway of nerves in the body. The Babinski sign is typically seen in infants because their nerve pathways aren't fully developed. However, in adults, the presence of the Babinski sign might be a sign of a disturbance in the central nervous system. This is particularly true for conditions that involve the corticospinal tract, a critical pathway that carries messages from the brain to the muscles of the body. One of the key causes of the Babinski sign in adults is an upper motor neuron lesion. These lesions can result from a variety of conditions, including stroke, multiple sclerosis, or spinal cord injuries, to name a few. The presence of the Babinski sign in such cases indicates damage to the nerve fibers that travel from the brain's cortex to the spinal cord. The implications of the Babinski sign in a neurological examination are profound. Its presence can guide the medical practitioner towards a diagnosis, prompting further investigation into potential neurological disorders. While it's not a definitive diagnostic tool on its own, the Babinski sign is an integral part of the neurological examination toolbox, providing valuable insights into the functioning of a patient's central nervous system. To recap, the Babinski sign is a specific toe movement in response to stimulation of the sole. It's a normal response in infants, but in adults it could be indicative of a neurological issue, particularly those involving the corticospinal tract. The presence of the Babinski sign can suggest an upper motor neuron lesion, prompting further investigation into potential neurological disorders. So, the next time you see a doctor gently stroking a patient's foot, remember the Babinski sign and the wealth of information this simple test can provide. It's a fascinating glimpse into the complex world of neurology, where even the smallest of reactions can provide profound insights.